Hi, I'm Henrietta. Welcome to the show. On this very special edition of Talking with Henrietta, we'll replay San Mateo County Health's media briefing. It's called Increasing Access to COVID-19 Testing is All About Equity. I hope you'll get a lot of useful information from the show. So stay tuned.
Good afternoon, and thank you for joining us today. My name is Nina Lee, and I work for San Mateo County Office of Community Affairs. We would like to welcome you and thank you for participating in today's briefing. Increasing access to COVID-19 testing is about equity, reducing disparate impact on vulnerable communities. San Mateo County is expanding COVID-19 testing opportunities, including additional mobile operations. Increasing access to testing plays an important role to slow the spread of COVID-19. Local data reveals that people of color have been the most impacted by the pandemic. San Mateo County is taking a culturally competent approach to reduce disparate impacts on vulnerable communities. This includes providing increased access to no-cost COVID-19 testing, as well as public health and social service resources to underserved communities. We want to make sure that everyone, regardless of income or immigrant status, or whether they have insurance or not, has access to a local testing site. Without further ado, it's my great honor to introduce our host for today, Henrietta Burroughs, who is the founder of East Palo Alto Today, the first continuously published newspaper in East Palo Alto in 20 years. Burroughs is an award-winning journalist who started her career in New York City as a newspaper reporter. She later became a television news reporter and worked for several television news stations. She currently produces and hosts the bi-weekly television show, Talking with Henrietta, which produced at the Mid-Peninsula Media Center in Palo Alto. Thank you, Henrietta, for joining us today.
Nina, thank you so much. It's an honor to be here. We're at a very critical time in our country's history with COVID-19 and in San Mateo County's history right now with COVID-19. So we have a distinguished list of panelists to talk with us who can give us their expertise on the subject. And it's wonderful that we have someone with us, Hector Alvarado, who is a resident, San Mateo County resident, who tested positive for COVID-19 in September. Hector not only is a county resident, he's a spouse, he's a father. He works a daytime job and volunteers at his church with media technology related projects. His COVID-19 experience happened in early September, where the virus affected him at work and spread to his family members. So we'll listen to him now as he tells us how the virus affected him and also how it affected his family and those around him. Hector.
Thank you so much for the opportunity. My name is Hector Alvarado. I'm a resident in Redwood City. And yes, September 4th is a day that I will forever remember. It was the day that I started showing symptoms for COVID. As far back as, or as far as we know, my exposure to the virus came from one person that came to my office. I work in a construction company, and the company, we have a protocol for everybody to come in. That comes in, we require masks, and unfortunately, the person that came was someone that was very close to us, and and we felt that we could trust this person. So we felt very comfortable. The person that came in was not wearing a mask. And from that, I was the first contact, and in our office, in our fabrication shop, we had 8 people that contracted the virus on the same weekend. And from the 8 people in our fabrication shop, then we all went home and we passed it on to our families. My wife was diagnosed with COVID. I was diagnosed on September 7th. My wife was diagnosed on September 8th. My in-laws, my father-in-law and my mother-in-law, were positive on September 10th. My sister-in-law on September 11th. So it's just, it was fast. It came in fast. And so when I started feeling the symptoms, I isolated myself in my kids' room. I was able to let my kids take their toys out, and then I went into the room. This was September 4th up until September 7th. Then my wife started showing symptoms, and so
did you immediately think that you did have COVID-19, or did you think maybe you simply had a cold?
You know, it didn't feel normal. I've come down with the cold or with the flu before, but there was something that was different. I usually don't break out in fevers. And that Friday, I felt that I had a fever, and it wasn't normal. So I didn't know. And so I went into my room, and that's when I messaged my doctor, and I heard from her until the next day. But I just wanted to take the necessary precautions. I didn't want to put my family at risk. I didn't know that I had already put him at risk before. But yeah, my wife then started feeling body pain, and that's when she went into her room. So she had to set up the living room for the kids. So we put in an air mattress, and they were having a ball outside, but they were at a very high risk to contracting the virus as well. So thankfully, I did the 10-day isolation here at home. My wife did too. My experience was a lot better than my wife's. My wife, she experienced harder symptoms. A lot of stomach problems. She already suffers from migraines, so this was multiplied a lot more during the virus. Nonstop fever for the 10 days. Then a lot of dehydration. And so what this caused was she fainted twice. And so we had to rush her to the emergency room. And that's where they gave her IV, and she was able to start her recovery process. Then we all got better. I returned to work on September 21st, so my wife was better a couple of days after. The problem was after the virus, and it is something that I never heard of, and this is what I experienced, and my boss also experienced. My wife stopped sleeping after the virus, and she will only sleep for 15, 30 minutes a night for 5 days. My boss actually did not sleep for 6 days straight. He would only take 15-minute naps. And what this caused, and my boss and my wife, is a lot of anxiety, depression also. So a lot of mental problems that it started creating after the virus. So obviously the virus itself.
Do those problems still exist?
No, thankfully they were able to recover a couple of weeks after. I know my boss, he got anxiety medication, and that helped him relax and be able to sleep again. But it took a week after he was, COVID, or he had recovered from COVID. So it's just definitely, it's not this virus is not a cold. It's not the flu. It's something completely different. At the beginning of the year, I did get a cold, and I thought that it might have been COVID. And I will tell people I think I already got it, and I think I'm good to go. Definitely, it's not a cold. I definitely did not experience COVID at the beginning of the year. It's something completely different, and we take major precautions now. We did before, and as you mentioned, I'm a volunteer at a church with 350 members. We haven't had big reunions. We've been following the church, the county protocols. And so I'm involved with people. So I try to take as much precautions as I can. The masks, I encourage it a lot, and especially at work and at church, we take so many precautions because we don't want anyone to be exposed to this.
Hector, thank you so much for sharing. And your words to everyone to take precautions. We might be able to get back to you as we go along, but we really appreciate your sharing.
It takes one person.
Thank you. At this point, we'll hear from Justin Mates, who's the Deputy County Manager for San Mateo County. Justin joined the county manager's office in 2019. He had first joined the county in 2012 as an attorney, where he represented a number of county departments, agencies, and partners on projects and programs in areas such as affordable housing, revenue and finance, sea level rise resiliency, and transportation. Justin holds a bachelor's degree in political science from Stanford University and a Juris Doctorate from Harvard Law School. He lives in San Mateo County with his wife and 3 children. And so what we'd like to do is have Justin talk about the county's expanding COVID-19 testing opportunities, to tell us what's being done to ensure that vulnerable communities have equal access to testing.
Well, good afternoon, everybody, and thank you, Henrietta, for that introduction. As you might have gleaned from that, there was nothing on there that said COVID-19 testing in my background, but the pandemic has really been an all hands on deck response effort from the county, as you might imagine. And for the last few months, I have been helping out with public health to help direct our resources around testing. And one of the big priorities for us has been trying to lower the barriers to access to testing for all of our residents, from all corners of our residents. And what we found early on is that we had a centralized mass testing site at the event center, which tested a lot of folks, but that there were barriers to access that testing for many of our residents. And so for many months now, we have added to not only have a stationary drive-through site at the event center, but we've tried to bring these drive-through sites closer to where people live and work across our county. So we also have a rotating drive-through operation that we rotate through the North County, the South County, and the coast to, again, try to lower those barriers to access, the geographic barriers to access testing. And we've been really expanding testing in the last few months in order to meet the needs of our residents. In fact, in the last 2 months, we have doubled our testing rates in this county, which we never thought we could do, actually, but by a combination of the county adding more county-sponsored sites, as well as more testing being available in our healthcare system, we have a much higher rate of testing now in our county, which is great, and it gives residents the information they need about their health. It also gives our public health office more information about how the pandemic is progressing through our county. Even with these rotating drive-through sites, though, we have found that there are still other barriers to access testing, and they come in a variety of forms. Some of it is geographic barriers. And in addition to the rotating site, we also are standing up weekly multiple neighborhood testing sites, walk-up sites that really are located right in people's neighborhoods, at your local YMCA, at your local elementary school, really, again, trying to make it as convenient, as accessible as possible to our residents. But there are other forms of barriers to access as well. A lot of these testing vendors require an online appointment system. Sometimes there can be a lot of questions that are asked that can be confusing, or maybe even for some of our residents who are inclined not to trust certain kinds of vendors or even the government, those can be a barrier to access as well. So we're aware of that. We have worked with our testing vendors to try to streamline those online application processes. We've also, where possible, we've partnered with our cities and our local nonprofits to staff sites and have greeters and others at sites who can talk to our residents in language and help them sign up right then and there if they found the electronic sign up or digital online sign up to be a barrier. And then there's also just sort of an information barrier. Sometimes folks don't know what opportunities are available and don't know how to access those opportunities. And so any kind of successful testing program also has to have a lot of targeted outreach, which we also do.
So Justin, have you found any resistance that people might have to getting tested?
I think that there are definitely feelings out there, and I think we've seen them in the media and elsewhere, where there are people don't necessarily know exactly what a positive test result will mean for them. And for some, there's a lot of concern that a positive test result could mean loss of income if you have to quarantine. You may not, depending on your employment situation, that could result in just lost wages for you or even the loss of your job. Another thing, that's something we've been sensitive to and have expanded our support resources for those who do test positive so that we have accommodation support if you cannot isolate at home. And we also have partnered with the Mental Health Association and other of our nonprofit partners to provide financial and food assistance to anyone who is positive and their families to get them through that isolation and quarantine period. But yes, there are definitely still some misgivings about testing, which is why events like this are valuable to help us try to get the word out about the importance of testing. If you've been exposed or you're worried about COVID-19, that it's important to get tested and that there are a lot of resources out there to help you get tested, including, and I should almost say this primarily, your healthcare provider. That is something that people often overlook. They, mass testing sites and community testing sites are terrific, and that's why we sponsor them. But also getting connected with your healthcare provider to get that test is so important. First of all, there's a lot of testing capacity in the healthcare system, and our healthcare partners are always adding capacity and have added a lot of capacity recently. But also, it's a good place to get tested because you're already connected with your healthcare provider there. If you do test positive, then you're going to be able to get that medical advice and medical care you need faster. So we really encourage folks to also test with their healthcare.
So Justin, once someone takes the test, let's say they drive up, it's a drive-in, drive-through, they take the test. How long does it take to get results? And if you could also tell us, what does taking the test consist of? Is it a swab in the nose? Exactly What happens?
Sure. Why don't I take your second question first? It can vary. It depends on the testing provider or your healthcare provider and their preferred means of testing. They still do testing in the nose, and sometimes it's still the deep nasopharyngeal, and sometimes it's the mid-turbinate kind of just partially up to your nose, and it can be self-administered. Some of the sites are also a mouth swab site. So it really depends, and there is not one standard out there. So that does vary. In terms of turnaround times, folks may be familiar that over the summer, across the nation, across the state, there were some really extreme turnaround times because of supply chain issues. Those have been, for the most part, resolved, and we are seeing much shorter turnaround times, averaging between 24 and 48 hours, so that people are getting results in a much faster time frame where they can actually act on those results.
So is it possible to get a negative test, a negative result, and then be positive? How accurate are the tests?
I'm going to defer to the physicians we have on the call. Maybe that question is more appropriate for them. I'm not a physician or a health professional. So yeah, I'll defer on that question.
Oh, okay. We'll keep that in mind. Is there anything else that people should know in terms of what the county is doing to facilitate testing? I know there are mobile vans that are going out to neighborhoods.
Yeah, we've got a variety of pop-up events. We partner with a variety of nonprofits to run pop-up events. We are also have a relationship with one of our testing vendors, Curative, and they have a mobile van that we are deploying across the county. These tend to be sites that we really are trying to make them neighborhood focused, very targeted. That means a couple things. One of them is that you may not see them on our websites because we're really trying to target certain neighborhoods. And so the outreach for those is on, social media, very targeted, next door, sometimes it's door-to-door canvassing. But we try to really get the testing to those specific neighborhoods. Our website is a good source of general information about testing, including the large community drive-through sites and ways to sign up for those. So we do encourage folks to visit our website. That's smcgov.org/testing. But also, and I alluded to this earlier, so much about testing is about outreach and making sure people have accurate information. And so the county has invested in those relationships in multiple ways, and that's through our Office of Community Affairs. We have a mask mobile, which is a very brightly colored van that we deploy to neighborhoods around the county, and we actually hand out free masks as part of that. In the last couple of months, we've handed out almost 14,000 masks, but also information and timely information, because as we know in this pandemic, information changes. Right now, information about the holidays is really relevant. And so that the community crew who we have staffing that van also helps get out that timely information to our residents. And we also have, we recently ran an RFP and partnered with 34 community-based organizations across the county to really be our partners in this very targeted outreach, not just about testing, but about the pandemic and how our residents can keep themselves and their families safe here. So really targeted outreach is part of this as well. We hope our residents get that information and are getting that information.
Thank you so much for sharing that with us. It's very much needed, the information, and very much appreciated. Dr. Curtis Chan can add more information to what we've already heard. Dr. Chan is the Deputy Health Officer in San Mateo County. He joined the San Mateo County Health in October after serving 9 years in a similar role in the San Francisco Department of Public Health. At San Mateo County Health, Dr. Chan's focus was on COVID-19 response, managing public health data related to cases and testing, and supporting community outreach. He earned his master's in public health at UC Berkeley and his medical degree at the UCSF School of Medicine, where he serves as an assistant clinical professor. So, Dr. Chan, you might have been able to answer that question in terms of people testing positively or being negative and later testing positive. So I'm wondering, given the time right now that we're experiencing, tell us what the San Mateo Health Department is doing, and in terms of what you're doing at the department. We can't hear you, Dr. Chan.
No, thank you for that question. And I think your question really highlights the really important story that Mr. Hector Alvarado provided. It's such a poignant story that represents the experience of thousands of people of cases in San Mateo County already this year. And Hector's story highlighted 3 important updates in science that are community, that's difficult to understand, but the science and evidence is more clear than ever. And these are the things that could help our communities protect themselves and protect grandparents and older adults more, particularly during this holiday. So the first important update is that we now know that half of COVID cases are infected by people without any symptoms. So what that means is that when you're wearing a mask, it's important to wear a mask even if you don't have a runny nose or you're coughing. So it's important to wear a mask, and it's particularly important. We now know because transmission is by actually from talking and yelling and singing. So it's particularly important that when you see your neighbor or you're talking to your uncle or the grandfather, that you don't pull down your mask at that time, because that's when that virus can be transmitted. And the second point about wearing masks is that it's particularly important within your own household. As soon as you get sick and you start thinking, I need to go get a test that Justin was just describing, or need to go get a test with Dr. Ty's medical group, as soon as you feel symptoms, you have to wear a mask even inside your house. Otherwise, as Hector was describing, it's really, really infectious, and everybody in the household and everybody in the workplace can be infected very, very quickly. So that's to my second point. Compared to the flu, as Hector was saying, it's much more infectious with the R0 that's significantly higher than the flu. And we now know it's much more deadly to older adults, particularly those who are over 60 years old. So what that means for us, particularly during this holiday, is if you live with an older adult or you care for an older adult, there's two things. We really need to be extraordinarily careful. And if you're a caregiver or if you live with an older adult, it's really important to get tested immediately with your healthcare provider, and we'll be hearing from Dr. Tai later on, or with our community testing site as soon as if you have symptoms. The third aspect of this of science I want to talk about is that there is this surge in the epidemic across San Mateo County, the state, and the country. And now what we're learning is that so many of these infections are no longer just in essential workers or in particularly small communities. It's happening in ethnicities and cities across the Bay Area, across San Mateo County. And a lot of it has to do with gatherings between friends of different households. So social support is really important, but it's really important not to be gathering without masks. So wear your masks when you're gathering. Try to gather outside and try to be really safe while you're supporting each other.
Dr. Chen, before we go to Dr. Tai, we hear a lot about quarantining oneself. I mean, Hector talked about how he quarantined. Mm-hmm. What does that consist of, and how does a person quarantine? Self-quarantine.
Yeah, I think that's a great question. So isolation and quarantine are two concepts that are very similar. So if you become infected and you have symptoms, that's when we would like you to be isolated for 10 days, because those 10 days are really when you're infectious. The infectious period happens particularly on the first days of symptoms and the 1 or 2 days before having symptoms is the infectious period. So that's for isolation, so you don't infect other people. So quarantine, as Hector was describing, is if you've been exposed, you've been in close contact with somebody who is a case or has symptoms, you're in your incubation period. So you've been exposed and you breathed in a little bit of virus, and you breathed it in, and that virus is replicating inside of you, it's replicating in the nose, and it's going to take on average about 5 days, but up to 14 days before there's enough replication in your nose that you yourself become infectious and infect other people. So we want you during that time before you become infectious, or it could be any time that you might become infectious, to be quarantining yourself from other people so you don't get other people infected at your workplace, as what Hector was describing, and also your other household members. So we want you to quarantine for 14 days because the incubation period can take up to 14 days.
Dr. Chen, thank you so much. Dr. Tai, I'm sure, can add more to the answer in terms of quarantining and other things that people need to be aware of. Dr. Tai, who's next, Dr. Kenneth Tai, is the Chief Health Officer from the Northeast Medial Services, which is known as NIMS. And he joined NIMS in 2005. And he's currently at the head of it. It's the largest community health center serving the Asian community in the United States since 1968. It has 12 clinical sites and over 70,000 patients in the San Francisco, San Mateo, and Santa Clara County. Over 90% of the patients served are Asians and nearly 19% are seniors over 65. Dr. Tai received his undergraduate degree in biochemistry from Washington University in St. Louis and his medical degree from the University of Illinois College of Medicine in Chicago. So Dr. Tai, please continue and tell us more about NIMS. I'm hoping I pronounced it correctly and what it has contributed to COVID testing efforts.
Thank you, Henrietta, for that wonderful introduction. So in terms of, because we were talking about the detection rate, as you mentioned earlier, it really depends on when the person present with symptoms. By the time the person has a symptom, generally that's when they consider to have the most virus, in their either nasal passage or oral cavities, and that's when they detect the most. So a lot of people in the earlier stages, when they may not have any symptoms for 48 hours, those of the times the detection rate is probably even less than 50%. So you have a lot of people who would get tested even though they may be negative, but in actuality, it's just in the earlier stage. So that they don't pick up the virus through their test. So it's actually very fascinating. There's a lot to go into it in terms of timing. In terms of what, because we talk a lot about the test, we still believe that testing and contact tracing are the key to really contain this virus. I know that in the last week or so, we have over 1 million cases in the US alone, and that's really a lot of cases. I mean, we have record high, historical high in terms of number of cases per day, and also the number of deaths, close to 2,000 yesterday. So these are devastating numbers. So what can we do as a community health center? And our key strategy is to test more people, people with who are vulnerable, people who are elderly, people who don't speak English as their first language. As Justin mentioned, trying to bring tests to convenient locations. I know that our testing sites, we established our testing drive-through from the very, very beginning in March of this year. We have tested over 6,000 tests throughout this duration. We know that's not enough. I know that a lot of efforts still need to go into it, but I think we're getting better. Currently, we have 4 testing sites throughout the Bay Area, but we're adding another one in December. So I think the testing strategy is what we're working on, and that's one of the key ways to contain the virus before the COVID-19 vaccines come onto market, which hopefully we've been hearing good news about the COVID-19 vaccines, which should come out hopefully early next year.
Sure, and talk about who's going to receive those vaccines first. Has
Sure.
San Mateo County kind of made a priority list?
Yes, I think there are still a lot of evolving discussions there, but the states, the feds have actually devised a list of what they call tiers of priorities. So in tier 1, I think your essential health care workers or first responders and people over 65 with comorbid conditions will be the priority number 1 to get vaccinated first, and then it will go to tier 2, 3, and 4. So I think the Governor Newsom is still working out the logistics. There is a task force specifically on the COVID-19 vaccines allocation distribution. So more will come, but we have 2 very promising vaccines that look like it will go through the FDA process, and hopefully we'll have the vaccines available by the end of this year, early next year.
It seems like this has been a very quick process for the vaccines, and some people might feel they might have been rushed. Should that be a consideration for people?
Yes, I think just to put it into perspective, generally a vaccine takes about at least 5 years from development of the identification of the virus all the way to going through all the phases, the trial, 3 trials through FDA trials. So typically that timeline is 5 years or more. And now you have this COVID-19 vaccine. We identified this virus probably in January of this year, and it's only been about 10 months or so. And that the speed, the effort, the impact, the devastating impact of this virus has on the world has been unprecedented in the past. So I think that definitely, through these trials, they are enrolling 30,000 to 60,000 participants, but it's still considered to be small number. But I think that generally Governor Newsom actually will also have an additional task force looking at these vaccines, even though after it's approved by the feds, they will have a task force looking at the safety profiles for these vaccines. But from what we hear so far from the 2 leading vaccine manufacturers, these are very, very safe vaccines.
Well, thank you so much. It's what you've said is very, very helpful. Is there anything else that you might like to add that you think is important that we should know?
So I think going to the point of the people who are vulnerable in our own internal testing data, what we find is that this is actually pretty interesting. I'd like to share with you if I can. Spanish and Vietnamese speakers had the highest proportion of COVID-19 positive infections compared to other language groups, with positivity rates ranging between 11 to 15%. Generally, other groups are probably around 2 to 3%, but for our 6,000 tests that we have done, people who speak Spanish and Vietnamese actually have, 4-fold higher risk of being tested positive for this infection. So I think our efforts is really gearing towards reaching out to those vulnerable population.
Dr. Tai, thank you so much. If we have a chance, maybe we can ask why the COVID-19 incidence is so high. In the meantime, we're going to go to another county resident who has also experienced COVID-19, and her name is Melissa Aliu, and she'll correct me if I mispronounced her last name. Melissa is a Christian who's a first-generation Samoan and Tongan scholar. She's a community activist and counselor educator. She was born and raised in the Bay Area. She's actively committed to community and civic engagement through her ministry and her faith-based partnerships. Among her active roles within higher education and remote online teaching and counseling. So Melissa, talk to us about your experience with COVID-19 and what you think is important for us to know.
Yeah, hi everyone. Thank you, Henrietta, and everyone that has spoken before me. I want to just acknowledge just the breadth of knowledge that is in this space that I'm learning from too, as we continue to speak and share space with each other. But yeah, I think for me, being born and raised in the Bay Area, when the pandemic hit earlier in the year, I think I was faced with multiple things going on as a community college educator who counsels and teaches at the College of San Mateo. we all have multiple roles that come into place, that when a pandemic hits, we are now faced with addressing this issue in a way that also impacts every other area in our life, depending on now safety and our health becomes the priority at the forefront that normally beforehand, because of our privilege of feeling safe enough or okay, we don't really think about. And so I think the approach that I just want to share for you all as someone who is Pacific Islander, my dad is Samoan, and my mom is Tongan. And so for those that don't know, are indigenous to Oceania. And so in the Bay Area, we have a fairly larger population and concentrated within the Pacific Islander community. And because of that, comes with a lot of cultural context and implications that for a lot of us serve as barriers to getting tested for COVID-19. And the way that I was introduced to this is through social media. Now more than ever, everyone is living a virtual world where we now have access to screens in a way that we have never had before, and constantly growing. And so I first heard of these different opportunities through social media. And so it came from my communities. So people, family members who look like me, who come from the same background as me. And I think Justin mentioned this earlier on, there is a trust factor of the information that is being circulated, who is circulating that information, and do I trust that person or that community enough to see that information as viable? Regardless if we know that it is, it's how we as a people receive that information to practice it. And so my process in getting tested for COVID was honestly fairly easy, and like many of you have mentioned, really convenient. I would say now more than in the very beginning when the pandemic first came to us. And so the streamlining process was easy, but I also recognize as a younger person who I feel slightly confident in technology. It was a little bit easier for me. And so, yeah, doing the drive-through process, doing multiple different forms of getting tested. So doing the self-administration process, and also having the technician do it for me has also been my experience in getting tested. The results have been convenient as well, right? So I just got tested on Monday, and I received my results yesterday, and it was negative. So I think—
Why did you decide, Melissa, to get tested?
Yeah, that's a really great question. For me, the reason I feel at the core of why I decided to get tested and why moving forward I will always get tested and make it a thing is because family, right? Is because the way that our cultural practice is set up is this idea around, it's a Tongan concept called Tauhiva, which, as I can best translate it in English, is nurturing and stewarding the relationships between myself and other people. And so if I care about the people that I love, and if I really truly want to center safety, getting tested should always be a form of a norm that I should take up and practice because I care about the people that I love. And although COVID-19 messages and guidelines are widespread, right, and the messaging is generalized, in the beginning, it didn't really feature Pacific Islander faces or touch our community values, sometimes making it difficult to resonate with. So many Pacific Islanders, like a lot of Black and Brown communities, live in a household like myself that is multi-generational, with several people living in the household where quarantining is not necessarily an option. And so having these conversations birthed creation of Pacific Islander COVID-19 response teams that were created in part to identify and address some of these issues, including racial disparities and health inequities. And when I mean COVID-19 response teams, it's just a fancy word of saying anybody. So like from Pacific Islander medical professionals to pastoral faith-based leaders to community organizers who have always historically been women, as it would match to our cultural practice.
Melissa, Thank you so much. And
Yeah,
I should say we all thank you for caring about others
absolutely.
and caring enough to take the test.
Yeah, anytime.
Yes, someone else who can talk about the caring, I'm sure, is Shireen Malekafzali. Shireen is now San Mateo County's Health Equity Officer. She brings over 15 years of experience advancing health and equity through multi-field partnerships, community leadership, policy advocacy, grant making, and research. Congratulations, Shireen, on your new position. So talk to us about what you do or what you will be doing as the Public Health Equity Officer, and share more about your role in terms of how what you do will affect all of us.
Thank you. And hi, Henrietta. And first, a sincere thanks to Melissa for sharing her story, and Hector, and also for Kenneth from the many CBOs who have pivoted from their daily activities to respond to the changing needs of the communities they represent and serve during COVID. I actually see a number of our CBO partners like Lisa Teeler from Baychak on this call, Pastor Bussey from St. James, and Veronica Escamez from Casa Circula Cultural, who are doing a million things, including now on top of those million things, leading COVID testing events in partnership with the county, which is a huge reason we are now increasing our testing numbers, especially in our hardest to reach populations. So thank you to those. Yes, I'm super excited to be taking on the new role as Health Equity Officer. As a Middle Eastern immigrant to the US, I've grown up very sensitized to inequities and discrimination and dedicated my life to advancing equity and justice. So this is a real welcomed opportunity. As far as what my new role really emphasizes, I think how seriously the county and county health are taking equity. It's not a siloed effort only I will take part in, but really a lens we're taking to all of our work. And the role will focus on knitting together some of the equity threads throughout county health's response to date and helping advance them and identifying gaps. And really our primary approach that county health is taking is to trust the science, and you heard a lot of that spoken through Dr. Chan, and the expertise of our most impacted communities. Part of this role will entail further engaging our community residents and leaders to learn from their expertise, their experiences and suggestions, and improving our response and proactively planning for the needs of our communities. We really do see our community leaders as our teachers. And COVID has disproportionately impacted our communities of color, like Dr. Tai mentioned. Our communities of color were really behind the 8 ball before COVID hit, with historic and structural barriers limiting just economic, financial, educational opportunities. And when COVID hit, it just exacerbated all of those things and the disparities, as Melissa mentioned. So, we've been holding town halls. We've held 3 race and COVID town halls led by our Office of Diversity and Equity to hear directly from our most impacted residents and CBOs. We've held 2 racial equity forums internally for all of our health staff, our contracted partners, our health boards and commissions, to share the importance of equity across all of our health work. And we've actually developed a specific health equity plan that outlines strategies and metrics related to anything from testing and outreach to contact tracing and more. And we report back to the Board of Supervisors regularly and update that plan and metrics on our website for the public, because we really do want to be held accountable to our partners and our communities. It all comes down to just a strong belief that leading with the needs and aspirations of our most impacted communities will ensure that we're all better off in San Mateo County. So really just thank you, Henrietta, and thanks to all of our community leaders and CBOs and leaders within their families, within personal circles, that are helping share prevention mechanisms, especially during this holiday season. And thanks.
Yes, I didn't mean to cut off your last words, but thank you so much for sharing. So now is the time for questions for the press, from the press, and for others who'd like to have some additional information. And I've been checking the the chat box. And there is one question for you, Shireen, and that is this a new position, the Health Equity Officer?
It is a new position. We haven't had that previously. And like I said, the equity work has been happening in different places, including some work that I was doing previously with our Health Policy and Planning Program, our Office of Health Equity and Diversity. But now this position solidifies that work and knits it together in the COVID response in particular.
Sure. Now, I don't see other questions in the chat box right now. So what I'd like to do is invite all of the panelists who've been listening to each other. And of course, we've all been listening to each other. What would you like to add, or do you have questions of each other? And is there other information that we should be hearing that we haven't right now heard? Justin? Dr. Chan?
I see there's more some questions coming up, but no, I mean, I actually want to just reemphasize the point that Shireen made, which is sort of we're learning about the pandemic response all the time, including how we can best meet the testing needs, or at least from my point of view, the testing needs of all of our various communities. And it's not just along ethnic and racial lines, right? It's our unhoused population, our seniors, young people, school-age children. So I think that the more we collaborate, and I think that is something that really characterizes how we do things in San Mateo County, we work together on them, and our community partnerships are so important for all of us to learn how we can better serve our residents, because I don't think any of us think that we don't have room to improve on this front in the entire pandemic response, but certainly in the testing arena as well.
Thank you, Justin. Mary Lou has a question. How has the county addressed data privacy concerns raised by neighboring counties in regard to Verily Inc., which is the testing company? So would any of you like to answer about how the county's addressing data privacy concerns?
Yes, I'm happy to take a stab at that. And the general context is these things evolve, and they are evolving. And we have a good relationship with Verily, and we've been working closely with them on their platform since the state first sponsored a Verily site in our county early on in the pandemic. And so, Verily, like a lot of other companies in this space, part of it is they do collect information, but we have worked with them and confirmed and verified over and over again that they are notifying users of how they will use information. A lot of it is anonymized, and then you have opportunities to opt out for your participation in any other kinds of research that they do. So this is, again, one of those things where it's an ongoing conversation, and I think the needs of our residents evolve over time, and Verily's own practices evolve over time as well. But we have conversations with them all the time about making sure that they are appropriately protecting users' data. They certainly have to comply with the entire regulatory framework around test results and patient information. And they are, their contract with the state, the state will hold them accountable on those things as well. And also just note that, Verily is not the only test provider in our county as well. There are other test providers.
Sure. No, I just want to be very specific, because what Mary Lou said is that Verily requires people who access their tests to have a Gmail account and to provide sensitive information, and the funding for these sites is in low income areas, Latino or Black neighborhoods. And this information may be benefiting higher income residents in other communities. So has there been any concern about this, and has there been any consideration for any reason of terminating Verily's contract? Now, I know you said that Verily is not the only vendor offering testing services.
So, we have heard our residents' concerns around these lines. I will say first and foremost, just this the event center site is a state sponsored site. And so the state has a broad relationship with Verily. And in that way, the entire decision is not at the county level. But Verily has responded to some of the concerns that folks have had about how the information is used. I don't have their response in front of me. I'm sorry about that. But there was concerns a few weeks ago about that some information came out, and Verily has straightened the record on that. And so, there are clear opportunities for folks to opt out of the Verily system. In addition, we recognized early on that creation of a Gmail account was a potential barrier for folks to use the Verily system. And in fact, we worked with Verily and as well as local partners to figure out ways around that, temporary accounts that only last for a certain amount of time. And so that you don't have to sign into the entire kind of Gmail, Google platform in order to get a test result. And so these are concerns that we're sensitive to. Verily also tests thousands of people in our county and across the state. And so, the concerns of privacy, I think, do have to be balanced against the value that testing vendors like Verily bring to the table. And again, if there are concerns, if people really have concerns about Verily, there are other testing vendors and test sites that our residents can avail themselves of.
Justin, thanks so much. Dr. Chan or Dr. Tai, could you say something about contact tracing? What that involves and why it's so important?
Sure, I can take a stab at this. So contact tracing is really, when someone gets exposed or infected, actually, who tested positive, you would like to make sure anyone who is a close contact with that infected individual to test those patients and really quarantine them. The thinking is really trying to contain the spread. As you heard from Hector's story, the COVID-19 virus is highly contagious and it's evolving. So that is the work, that is a crucial work to really identify other individuals who may be at a higher risk to get infected and really get them tested and quarantined so that they don't in turn infect others. So contact tracing can involve, from a single individual who tested positive, it could involve 10, 20 other people. I mean, as we know, we actually interact with a lot of people these days, and there are certain definitions of close contact, such as if you spend more than 15 minutes over 24-hour period of time with someone who is within 6 feet, even though you're wearing a mask, you actually are considered to be at risk as being a close contact. So someone like that will definitely need to be considered to be a higher risk to get infected. Other people are like, in your household or your partner and so forth. So there are a lot of things that we'd looked at.
One final question that hopefully can be answered in like 1 minute. It comes from Fernando Torres. Besides the use of masks, what is the most important message for Latinos and Vietnamese? What can they do to combat the virus? Anything quickly you can say?
So I think just quickly, I did respond to Fernando's question. That's a great question. Again, social distancing, there are people who say 6 feet is not enough, but at least 6 feet, and then masking and frequent hand washing. I mean, that's again and over again. Two of the biggest risk factors how people get COVID is doing, when they take off the mask and when they eat, when they drink. And those are the two of the biggest predictor of getting infection. And the other message I would say is the safest way to spend your Thanksgiving and Christmas holiday is to spend it with your immediate household. Unfortunately, the virus is highly contagious. There's incubation period. Up to 20% of people are asymptomatic. So, let's say, if you may have someone who may be very susceptible, elderly patients, they get infected and they may, have a lot of serious consequences from COVID-19. So again, the message is to spend the holiday in your own bubble.
Thank you so much, Dr. Tai, for
Can I just add?
And to all of the other panelists for the information that you've shared that is so important. And our session is winding down, and so I'd like now to turn it back to Nina.
Thank you, Henrietta. Dr. Chen, sounds like you have something you want to add on before we ending.
Well, I agree wholeheartedly with Dr. Tai. I think particularly for our community that we're talking to today, I think there's two clear points. Is that if you're concerned, get tested right away, isolate yourself, put that mask on. And that second point is trust contact tracing. It's really our staff and our teams and county government and community-based organizations throughout the Bay Area that's reaching out to you. And we're contacting you to see if you need quarantine, to see if you need more testing, to see if you need resources and information such as housing, access to public benefits, paid sick leave, all that information that we collect at local health departments are not going to immigration. They're not going directly to the feds. We're utilizing it with local government here to protect you, to make sure that we don't have 11 people or 9 people, 11 people in the household or 9 people in the workplace that gets the infection. So I just want to say, I mean, those are 2 additional things. Get tested immediately, isolate yourself, put a mask on, and answer the call from the contact tracer, because we're here to protect your entire family, your extended family.
Thank you, Doctor. Thank you, everyone, for joining us today. Thank you again, our wonderful panelists, for the informative discussion. Due to the time restraints, we couldn't really answer every single question from the media friends. So I will type my email into the chat box, so you can definitely follow up with me, and we can definitely forward your questions to our wonderful panelists. So just want to say, we are in this together. Our comeback depends on all of us. We couldn't emphasize this enough. Get tested, wear a face mask, wash your hands often, and social distancing. So holidays are coming up. So wishing everyone a safe and happy holiday. Now the conference is ending. Thank you, everyone.